Welcome to Star Hospital's podcast.
I'm Dr. Chandana, consultant pulmonologist and critical care specialist at Star Hospital. Today I'll be talking to you about asthma. Asthma is a common disorder which is seen world over. Many people have a lot of false beliefs and concerns regarding asthma and inhaler use. Asthma is an allergic disease where people have allergy to common substances like dust, pollen, animal feathers, fur, smoke, air pollution, etc. Because of this allergy, they develop narrowing of the air passages, which leads to difficulty in breathing and chest tightness and wheezing. This can also lead to a lot of production of sputum and cough. Asthma can start in childhood and go on into adulthood. Some people it can decrease during their teens and again recur once they are in their 40s or 50s. So asthma is usually diagnosed based on clinical symptoms and examination by the doctor. We can also do certain tests like the blood test, lung function test or an X-ray only to assess how severe your asthma is. The main treatment for asthma is the use of an inhaler. Inhaler is a device which provides the medication directly to the lungs. By providing medication directly to the lungs, it causes very effective medication use and also has no side effects on the rest of the body. So it's the best way to deliver the medication to the lungs, is the best and the safest way to give medication for asthma. Asthma medication through the inhaler has two main medications which we use. One is the steroids and second is the bronchodilators. Bronchodilators are the medications which will cause opening up of those airways and give you symptomatic release and make your breathing easier. Steroids are the medications which actually control your asthma, decrease the allergy, decrease the inflammation, and they prevent your asthma from becoming worse and your lungs from getting damaged. So steroids are the most important medications which are given to the inhaler for your asthma. So both these medications need to be used in the inhaler form as prescribed by your doctor based on your severity of your asthma. Apart from these inhalers and these medications, some people do not have control of asthma in spite of using these medications. So there are other conditions which can worsen your asthma such as stress, depression, overweight and obesity, GERD, that is gastroesophageal reflux disease, and also sinusitis. So in some patients where asthma is not being controlled adequately by your using inhalers, these also need to be considered, diagnosed and treated appropriately. Apart from that, recurrent viral infections also can precipitate attacks of asthma. So we need to vaccinate people with asthma every yearly with the flu vaccine and other vaccines as required to prevent these infections and prevent the attacks of asthma. So it is very, very important for us to control the asthma well by the use of inhalers, because once asthma is controlled by using these medications, an asthmatic person can have a normal, healthy lifestyle. At Star Hospital, we provide all the facilities for us to diagnose and treat asthma in a complete manner. Thank you.
Thank you for listening to Star Podcast.